Hey everybody, thanks for joining us. It is Q&A time. Anything goes. I hope you guys had a good holiday weekend and go ahead and fire away.
And go ahead, Linda.
Hey Linda.
Hey, Greg, good to see you again. Happy
Good to see you.
holidays and all of that. Um, Before I get into my question, I have to tell you that your bits of wisdom just blow me away. And you
Oh, you're
always,
so sweet.
no, you always drop these little things that sound like that's just a little thing. And then I go and I do something with it and I go, oh my God, that was not just a little thing. And the little thing just I want to feedback to you on was you talked about sweeping. I was when my friend with the pulmonary fibrosis, you talked about sweeping the skin
Yes.
specifically, right,
Yeah,
with
yeah, yeah.
a particular color, and so I've been playing with that, of course, with some of my other folks I work with, and it's phenomenal. What a
It's
difference
mind-boggling
it
how good
makes.
it works. Yeah,
Yes,
yeah, yeah,
yes. So
yeah.
thank you, thank you, thank you.
Yeah.
And
You,
I
you
was
you know where I picked that up? Like, if you look at it from an energetic point of view, the health rays are associated with the pores of the skin, but even there, like I didn't quite make the connection. But I was reading, and it was like it was a medical book back when allopathic medicine was just beginning. So like allopathic medicine was still like kind of what we would call holistic medicine now, because there was this big thing where, back in the old days, you had to do it with herbs, or you had to do it with, your tricks or manipulation or something. And then people started using pharmaceuticals. And so back in the early days, it wasn't developed. And there was this chapter in this old allopathic book that went on and on and on about um, uh, like immune conditions, where the immunity was that the skin was depleted, and so they had these remedies for treating the depletion of the skin. And so I was like, I never really thought about it like that. And so I went down the rabbit hole. And then in Chinese medicine, I think that's the thing that I was referencing when we were talking, is part of how the lungs detoxify and how the body detoxifies is through the skin. And then, it kind of kept going down the rabbit hole. And when we were doing that study for allergies, a lot of what we call digestive allergies, when we would treat the digestive tract, it would get a little bit better. But when we would treat the skin, they would get substantially better. And I was just like, who would have thought? Like, there's no way you would put two and two together like that, at least not with our kind of way we think about things now. And so, you just like, it's just a bouncing ball through the rabbit hole. And I go to the skin sometimes when nothing else is working. There's a few things that I go to, and the skin is one of them. Keeping the skin from getting depleted is good for immune related conditions, respiratory conditions, digestive tract, allergies, things like that. It's all super important for all of that. And yeah. And, it's a weird thing. Like, you might want to even continue to explore, but I was using it there for a while, treating mood disorders. And, it was just, a series of neurotransmitters and things that was causing the mood disorder. And it doesn't mean that it works every time, but it worked more times than it didn't. You know what I mean? Like, it was one of those things where, I was just treating it energetically, and I would have them use some parsley and a salt bath for a while, and we'd pull them out of a mood disorder. And one in particular was, there was this gentleman that when he was like in his late teens, like I think the guy was in his mid 40s when I was treating him, but in his late teens he'd been at a party, and somebody handed him something that he thought was a joint, and it turned out to be PCP. And he took one puff off of it, or whatever you call it, and he realized that it wasn't what he thought it was, and that caused a mood disorder that had affected him for like 20 years or something. And we treated the skin, and the mood disorder went away. It was actually lifted by the psychiatrist, and it was the skin. For whatever reason, the because PCP is like an elephant tranquilizer or something, and it threw the neurotransmitters off to such a degree that he had this, just the one exposure. He had a mood disorder and had tried everything, and I was just like, yeah, let's just try this skin thing, and it actually cured it.
Wow.
Yeah,
See,
like
there's
weird and
another
bizarre.
great,
Like,
yeah, but there's another really great tidbit for us. Oh my God,
yeah,
thank you.
yeah, weird and bizarre.
Yeah.
Yeah.
So my question today is
Mhm.
actually for a friend of mine who's here on the call, Tina.
Mhm.
She's having difficulties with asthma and
Okay.
with ear. We don't know if it's an infection or what. And Tina, you can unmute yourself, and I would rather you kind of explain to Greg what it is that's happening.
Hey, Dina.
Hi, Greg. Nice to meet you.
Good to meet you.
Thank you for your time, and I just
My
appreciate
pleasure.
being here today. So I, just to give you a little bit of history, I
Mhm.
got sick, I guess, with a cold sinus situation back in end of September, early October.
Mm.
Fast forward, I've been sick again for another week,
Okay.
just recently. And I do realize that it's like sinus issues, some congestion. I have inflammation obviously going on somewhere, everywhere, it seems like. And asthma's been kind of escalating a little bit. And then my left ear, I have like, what is it, eustachian tube dysfunction that happens in that ear specifically, but also
Okay.
it's been really uncomfortable. I'm still trying to kick the remnants of whatever is going on right now.
Does the ear bother you? Like right now it's bothering you, but does it bother you from time to time prior to this, or has it just been this situation, the ears popped up and has been an issue?
It tends to happen from time to time when I'm not sick, but it's exacerbated at this point right now because of anytime I get sick, it just
Yeah.
immediately left ear just gets a little bit off kilter. And at nighttime it's worse, for me when I'm
Okay.
lying down trying to sleep.
Yeah.
And in the morning, so like this afternoon I'm finally feeling better, but it's taken most of the day for it to kind of subside.
Right. And then when you go to bed again, it kind of does
Yeah.
the cycle. Okay, gotcha.
Yes.
And tell me about the asthma. Has this just been like, is it acute? Has it been recent, or you've had a little bit of asthma prior to this?
I feel like it's increased. I mean, because it goes through cycles when I get sick. So I have to listen to my body, like go through the cold first and try to make
Mhm.
sure it doesn't go to the chest. And then it's like asthma, but it's been more recently, the past like 4 days for sure. Like asthma's, I treat that daily with medication all the time, but I think it's like been pretty bad the past 4 days.
Okay.
Mhm.
And it's like allergic, like asthma that's a result of allergies, or do you
I
know?
do have allergies. Yeah, I do have allergies for sure. And
Does the asthma get worse upon exercise, especially like fatigue? Does it get worse with fatigue?
in the past when I did exercise, yes, yes,
Okay,
yes.
so I think you have two issues as far as the asthma is concerned. Is I would use like it's crude vitamin C, which is quercetin. And you can just go to the health food store and get the quercetin. And quercetin always needs to have uh bromelain in it so that it can be
Mm.
processed. But basically, like the crude vitamin C, like regular vitamin C, passes through your body too quick. And when the body is vitamin C deficient, like 90% of asthmatics are vitamin C deficient. And so um by elevating the quercetin, I'd say within 30 days, 45 days, it would probably improve to the point where you could either reduce your medication, with your doctor, or even go off your medication. Um, but it needs to be like 3 tablets like twice a day. And sometimes it doesn't work as well. Like you'll still need the medication, but most times we're able to get people so that they don't necessarily need to use the medication unless except for times where you're really struggling or something. And so every once in a while we need to do bigger dosages than that, but you can just go to the health food store, get some quercetin with bromelain and 3 capsules twice a day. If you want to do it at first like 3 times a day, you could do that. But I've had people who have even been in the middle of an asthmatic crisis, and we just give them like every 45 minutes, we'd give them a dose, and within 4 or 5 hours they were completely out of crisis. And so the other thing that I would say is that magnesium is always good in a situation like this, about 400 to 500 milligrams. And the issue is a lot of times the asthma medications will lower magnesium serum levels. And so just the use of the medication will increase the need for magnesium, but usually asthmatics also need magnesium. It's part of the bronchioles are in a bit of a spasm. And so I would do that. The concern, like the reason why I was asking about exercise is there is a thing called exercise-induced asthma, and that is usually like omega-3, omega-6 oil like deficiency. And so I would do like fish oil, or if you don't want to do fish oil, like flax oil or hemp oil, something with like omega-6s or 3s or something. And usually within about 30 days you'll notice like the breathing feels much stronger. The ear is probably not an infection, like it's probably most likely an inflammation. And the treatment that we just talked about might knock it out. But if it doesn't, you have a couple of choices. The thing with asthma is you could either do like hyssop, like, just inhaling hyssop for a bit. That will reduce some of the bronchial spasms and open up the bronchioles and the respiratory tract, and a lot of times it will take some of that pressure out of that ear. Another one would be there's different kinds of myrtle, but I would do green myrtle, and the reason being that myrtle by itself is very good for the respiratory tract, for breathing, for asthma. It's really gentle. You could use it even on children, where like some oils you don't use on children because they're too strong or they're too overstimulating. And so with asthma, sometimes that can be a case. Like, sometimes you have to ease in the use of like eucalyptus or something like that, which you would think would work really well for asthma, but sometimes with the asthma, it makes the respiratory tract too reactive. And so I would say myrtle is a very good place to start. It will reduce the inflammation, and you want to use green myrtle, by the way. Green myrtle will reduce inflammation and open up the respiratory tract. So it will reduce inflammation in the body, it will reduce it in the skin, but it will reduce it in the respiratory tract, but in a way that's very, very gentle. And so that's kind of where I would go with that right off the bat. And then over a period of time, you can start adding other things to treat it with essential oils. But usually with asthma, like if you're not having bad cases of it, you could probably even just get away with treating it with quercetin. Like that could be enough. But in really severe cases, I usually have them People use quercetin, magnesium, and then there's another herb. It's a mushroom actually called cordyceps. And cordyceps is very fortifying to the respiratory tract, and it diminishes the production of mucus and kind of regulates that in the mucous membrane, and it's not necessarily like a treatment for like, oh, you use that for asthma to reduce the symptom, but like used over a period of time, it's so fortifying to the respiratory tract that like it changes how your body produces mucus and things like that. And it can be very helpful, but it's not always necessary. But if you end up using it, you need to use about 3,000 milligrams a day, which is about 6 capsules. And so I'd start with quercetin and do the magnesium, and then the hyssop or the green myrtle to inhale, just to help open up the respiratory tract. It's probably not going to happen overnight. I would love to say like, oh, this is going to be it. But between the quercetin and the hyssop and or green myrtle, that ear should open up. So here's a like a kind of a weird thing that sometimes with that ear getting clogged up, sometimes that can be a byproduct energetically of the spine being really congested. And that could happen for all kinds of things, stress, people projecting things at you, who knows. And again, I would probably use, you could do it with the hyssop.
Okay.
Sometimes with more severe cases, we use some other like balsams and things like that. But what you would do is, for just treating the ear, you could just get away with just inhaling it. But for really kind of cleaning up the spine, is you would put your awareness on the spine as you take long, slow, deep breaths. And the area that's of concern would be like, just put your awareness on the whole spine. But if somebody's going to do healing on you, like if Linda's doing healing, it would actually be the front side of the spine. So you would actually clean like from the front, and that will make the ears like expel quite substantially, because the spine goes up and then hits this area where the skull and where the brain rests and everything, and there's this little joint inside the head, and sometimes that is actually the thing causing the inflammation in the ear, and it's called the spinobasilar joint. And it's just like this, where the back of your head and like the base of your skull, like where the brain sits on, there's this little joint. And it's just like with the cerebral spinal fluid, like I'm even exaggerating the movement, but it's, it goes like this. But sometimes what happens is it gets like out of place, just like a vertebrae can get out of place. And so by going through and unwinding it this way, a lot of times that can regulate. And so in osteopathic medicine, they would say sometimes the issue with the ear could be what they would call a lesion on that spinobasilar joint. And a lesion, just in osteopathic medicine, just means like tight connective tissue, or that that joint is just slightly like off. It just is just a different way of saying like not, but in the connective tissue rather than in a muscle. And so let's treat it as if it's just a reaction to being sick and inflammation in the respiratory tract and all of this. But if it lingers, then we'll do a little bit deeper dive on not just the cold and flu and asthma, but cleaning up the spine and opening up the ear canals and that spinobasilar joint. And so I'd say the quercetin and the fish oil and the magnesium, I would take it probably for like 6 months. Like I would just take it for a while until, your symptoms are good and gone. If you had more chronic asthma, I would say it might even be a year or two, but eventually you could go off of it. But the other thing that you could use for prevention is there was a study where they had people use like 2 or 3 drops of frankincense internally, and the frankincense made them less reactive to environmental factors, which is like a funky way of saying allergic reactions or hyperreactivities to, things in the environment. And so that could be an option for you, but it sounds a little bit more acute. All of that being said, asthma is also, if you look at it, it's spasms in the bronchioles. And so there's this breath that you can do that helps to open up the bronchioles, where you don't really need to do any of the quercetin helps, especially because of the allergies, and the fish oil helps because of things like inflammation and stuff like that. And then the magnesium, the antispasmodic component, and then the oils for inhalation to open up the bronchioles and the inflammation. But there's this breath where you take a long, slow, deep breath. So you go, and then you hold your breath for a few seconds, and then you make your lips as tight as possible, and you make just like a little tiny hole right in the front, like you're kind of trying to whistle, but like how like when you're a little kid and you're trying to whistle but you had no idea, so you just blow out your lips expecting a noise. You'll do that, and I'll demonstrate it. But what that does is that manually opens up the bronchioles. And so you can use this to open up the bronchioles anytime you're having some sort of distress. It's something that is from Western medicine. A respiratory therapist would train you how to do it, but it's just a very simple thing. And so you inhale through the nose, and then you go. And the key is you're trying to blow as hard as you can with as much resistance as you can, which is manually opening up the bronchioles. So you'll do that like 3 or 4 times in a row where you. So you'll cycle through that a few times, and just that will open up your bronchioles quite substantially. And so I think between all of those, that should really help both the asthma, and if you open up the bronchioles, a lot of times it starts taking some of the pressure off the ear canal and all of that. So give that a shot and see how that treats you. And then after that, if it's still bothering you a little bit, we can go a little bit deeper on unwinding the spine, but that should get it.
Okay, thank you so much for that. I took some notes, and I'm going to start that regimen. I think the one thing that I am a Mexicana, so a lot of my herbs that I grew up with, and I do inhalation of the fresh eucalyptus leaf.
Oh, nice.
So
yeah, the fresh leaf should be okay. The oil could be a little too strong. If, I can't remember if it's from Latin America, but there's an old school herb that gets used sometimes for treating asthma, and it's lobelia. That actually can work very well.
Okay.
Too.
Okay. All right. Thank you so much, Greg.
Yeah, you're so welcome.
Yeah. Thank you.
And then go ahead, Chris, and then Barbara.
Hey, Miss Chris.
Oh no, Sammy, you're sick.
That's what happens when I get downtime. My body's just like, oh, okay.
I was like, what's this rest? I don't recognize it. Hey, Greg.
Hey, how are you?
I'm good, thank you. Yes, I was hoping to borrow your X-ray vision at
Sure.
night. Been going on probably this week. When I go to bed, I start coughing like a chest cough.
Hmm. And it doesn't feel like it's producing anything. You just feel
No, it's just like air
hmm,
coming. It's like an air bubble that wants to come out. I don't feel sick, nothing, no sinus, drip or sore throat.
so a chest cough. And it's like deeper in the chest. That's what you mean by
Yeah,
chest cough.
yeah. Only when I'm in bed.
Um, hmm. It feels pretty dry.
Mm, I mean, the cough is dry, but doesn't come out. Like, you know how when you're coughing and it's dry, it hurts your throat? It
Yeah,
doesn't hurt my throat.
doesn't hurt your throat.
Mm-mm.
I would say that the mucous membranes, like they look a little bit like thickened and dry. And so you could do that a couple of different
Okay.
ways. If you have Shazandra, um,
Mm.
either use it or bump up the dosage that you're doing, or you could use lemon.
Oh, like lemon water or lemon oil.
Lemon oil, like 6, 8 drops a day, maybe. And if you're going to do lemon water, like you know how you go to the grocery store and you get that big green bottle of lemon juice,
Oh, yeah.
like a tablespoon to 2 tablespoons a day of that. So I think that's the equivalent to like maybe 3 or 4 lemons, maybe.
Okay.
Yeah. Like, so if you're going to do just lemon, do like a lot of lemon, not
Got
just like
it.
a little wedge, like a whole lemon at a time.
Okay.
Yeah.
Thank you.
Yeah.
Can I
You're
ask you
so.
a couple more
Mhm.
questions? Someone who has porn addiction.
As what? Porn?
Porn.
Okay. Um,
Um,
so
hmm,
that there's a dopamine issue in the brain, um, with something like that. You know, there's a release of chemicals that kind of wash over the brain, and then it's
okay.
reinforced with, physical activity. And
Mm-hmm.
so, what did I used to do for that?
Did you say it's a chemical imbalance in the brain?
It's not a chemical imbalance, but it
Oh,
like it
chemical.
releases chemicals that kind of wash over the.
Oh, okay.
Yeah. Um, how bad is it? Is it pretty chronic or is it?
Mm-hmm.
Yeah.
Yeah.
Um, So this is the approach that I would take. Like you know, like anytime you're dealing with like an addiction or behavior that's repeated,
Mm-hmm.
sometimes it can be kind of tough to break the behavior, and so you have to kind of take a step back and go, okay, there's the behavior, but what is the motivation for the behavior? And if you
Mm-hmm.
look at what's kind of happening, you know, even though it's not a substance, there is kind of a substance that's being released in the brain that is still the substance that's being uh, pursued. And what I would do is I would treat anger. I would treat
Ah,
anger. I would treat anger and unwind it in the organs of blood purification. So um, lungs, liver, gallbladder, kidney, spleen, and then also in the arms and legs,
mm-hmm.
and then also in the spine. And then
Mm-hmm.
you remember in the body wisdom class how there was the compounds. After you've treated that for a little
Oh,
while, the what
like
we've
the
talked about,
cobalts and all that.
yeah, it's the one that
The deities.
yeah, had the deities in it.
Oh, the deities. Okay.
Yeah, like the, let's see, hold on. It was, oh, we just sec here.
Okay.
Very go. Anger. Anger was the back of the pelvis, the upper back, and the back of the neck. And the oil that we used for that was white tara.
Oh,
I'm gonna send
like
it
back
over.
of the neck.
Yeah, would you?
Yeah, I'm sending it over to.
Aren't you doing a class on the Taurus next year?
Yes, but I'm not sure. It'll probably be like in February or something. Okay, there you go.
Back pelvis.
So treat that pattern, be it with oils or with healing.
Okay,
Treat
EV, right?
that area. Yeah.
Right. One more, please.
Mm-hmm. But
Someone
it's going to
who
take you a while. Like on that particular issue, it's not going to be a quick fix. Like, you know,
okay.
you're having to override behavioral issues, and so, you know, treat this for a while, and then we'll probably have to have another conversation about it depending on where the person's at. But you know, however good or bad they're doing over a period of time, we can go through and evaluate the next phase.
Okay.
Yeah.
Someone who I'm just pulling my notes, Greg, 1 second.
And okay, it's like, so I still see something with that person. So when you're
Okay.
doing general healing, like after you've been doing healing for a little bit, you know, in the session, spend
Mm-hmm.
a lot of time sweeping, doing general sweeping on the backside of the aorta, like the backside.
Okay.
There's a lot of repressed anger about a person or a few people in that person's life.
Ah,
They don't have to address who it is or whatever. They just have to let go of the anger.
okay.
You know what
Thank
I
you.
mean? Like
Yeah.
the story generated the anger, but the anger is there. Resolving the story doesn't really change any of that. Like they still have a bunch of part of the addiction is trying to manage the anger. And so if you
Mm,
just try to take the addiction away, it's not really going to work very well, because then you're just taking away their only coping mechanism. Take away what they're trying to manage, and then it becomes easier to treat the coping mechanism.
got it.
Yeah. So
Thank you. Um, someone who's like overcome with fear, and their way of coping is like trying to control everything, and of course when you try to control too much, things fall away from you, right? And it's a challenge to unwind that in the physical body, to do healing. It's almost like you 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 do some healing and then we're back to square one.
okay.
How do you
Yeah.
unwind that intense fear?
Yeah. Did something happen?
Um, Probably. Something is happening right now at work for this person.
Okay.
Yeah.
But the intense fear, was that happening before something was happening at work, or they were prone to it?
I think they're prone to it. I
Prone to
think,
it.
yeah, they're prone to just wanting to control everything.
Yeah. I mean, that's a common.
Mm-hmm. Mm-hmm.
Um, feel like I'm still missing something. Okay, so they have a thing going on at work.
Mm-hmm.
Hmm. Hmm. I would say honestly, like if you look at the controlling thing, again, going back to, like, there's a behavior, but what is the motivating factor for the behavior? Like, what
Mm-hmm.
is causing?
I think there's a lot of anger
What's that?
too. I think there's a lot of anger,
Yeah,
and they're
anger, but I
looking.
would say more for this particular person, the there's trauma, but it's very specific to past events or a series of events. And so what I do is, like, I would start treating trauma from the onset. Like, even like when you treat the aura, trauma, like when you go to a chakras, trauma, but especially the chakras for the will. So the
Mm-hmm.
basic, the front, back, solar, the ajna, and the crown. But
Mm-hmm.
in that, add the throat at the very beginning of that. In the reason being that the throat is not a will center, but it's associated with like free will. It's like it's how we calibrate what aspect of the will we're going to use. Are we going to use the emotional will? Are we going to use a mental will? Are we going to use physical will, or a variation thereof? And so I would say start with the throat, and you're focusing on trauma. So if you're using oils, you could just do something like helichrysum, and then go through and treat then the basic, the front back solar, the ajna, the crown, probably heavy on the ajna. And then shortly after that, clean up the cords for whatever comes up.
Okay.
So sometimes, without, I kind of allude to this, but we haven't really like sat down and like really like gone heavy on this. But whenever you're treating something, especially like an old trauma like this, you kind of go back and forth between like the state that they're in and then the essence, and you keep going back and forth, back and forth, back and forth. And we talk about it from the point of view of the logical mind and the intuitive mind, but the state, usually for most people, even when there hasn't been like a strong traumatic experience, is usually a little bit unstable. It's just, they don't always feel, it's not that they're out of control, but they just don't feel like comfortable in their skin, you could say.
Right.
And then, so if you treat that, a lot of times it just brings out this feeling that is non-specific of just feeling unstable. And you see this a lot in pain syndromes. The pain syndrome makes the body feel very unstable, like it's in crisis. It kind of is, but it feels 10 times worse than what's happening. And then when you treat that,
Yes.
you then treat the essence. Like you go through and you just treat the body for essence, and that purges like a kind of fear, and different than the kinds of fear that we talk about in like some of the fear classes. It's just this deep irrational fear, like waiting for the other shoe to drop, especially the more that they've had bad experiences, the more that fear response is like engaged. And so you're basically kind of resetting that fear response. And so the thing that I use for treating the state is nerve help. Like I have them inhale nerve help. You know how we do like the front side, the left side, the right side, the back side, below your perineum, above your head, your spine. You do that with nerve help. And then for fear, I use
No, what's the nerve help for again? That's for the
it's for
essence?
treating the state. It's like it helps the
state.
body, helps the body feel stable.
Okay.
Like a lot of times in pain syndromes, that's what I initiate the treatment with, so that not only does it help reduce the pain and make the person comfortable, but it makes the body feel like it's stabilizing, like it makes the body feel more stable, which that by its nature helps to reduce the pain response. And so even here, while we're talking about like the controlling thing, it's not physical pain that they're managing, it's most likely from old traumatic events. And so they're trying to manage like psychological pain. And so the body sees it the same. It doesn't judge like this one's physical, this one's emotional. It just sees it as pain. So you go back and forth between, I'm just trying to remember what I use for that. So we use nerve help for the state. Oh, Friar's Balsam. I use Friar's Balsam for, if you don't have Friar's Balsam, like poplar balsam, poplar, the alchemical cobalt would work.
Oh, perfect.
Yeah. aloes could work. Like one of those three. But I just have them go back and forth, back and forth, back and forth.
Nerve
Um,
help, then fire also. Okay.
Yeah, and the issue is more in the, like, when you keep cleaning up the energy body, you're also cleaning up the nervous system and the immune system. At first it's just going to come out the aura, right? But as it starts to diminish, it's going to come out the sex chakra and the Mingmen. It's going to come out of the instinctive responses. And so, the instinctive responses, some of them we're born with, and then some of it is we have like conditioned responses. And so you're basically starting to break down those conditioned responses. And the conditioned responses are just from the past traumatic event.
Got it.
Yeah, you could always pepper in helichrysum in there because it's going to release trauma. It's going to help the person move past the event. But if there was like an ongoing situation, or it was incredibly, like one situation that was incredibly bad, or it's a repeating pattern, it takes a while, especially if the person was young when it happened. And so it's almost like you let go of treating. We look at like, okay, this comes and the presenting symptoms are XYZ. It's almost like you have to go, okay, I know that that's what the symptoms are, but I'm going to let go of that and just put the person like in a different place. Like, and then in a different place, think of it like this. Like you take one of the dogs that you have and say you just got a puppy, and you take it to the dog park and try to teach it how to sit and behave and wait for its little treat to do a little trick. Not going to happen. But in a quiet place at first, in the kitchen where nobody's around, and you tell it to sit and behave, it might take a little while, but it's going to be easier to do because the animal's not overstimulated, right? And so sometimes putting the person in a place where the state of the body is not as overstimulated by the traumatic event is creating a space for there to be like a deeper healing, if that makes sense.
Yes,
Does that make sense?
it does.
Yeah.
One thing I'm hung up on is how, when you say treat the body for the essence of fear, what do you
No, you're not even treating it for
mean by
fear.
that?
You're just treating, like, so your body goes between like the form and the essence. So the essence would be the animating factor in the body, and in the
Okay.
mind it would be the intuitive part. The form would be in the body, just like your structures, your physiological functions and things like that, but it would also be the logical mind. And so at first, when you're treating the state, you're just like forming the intention, like, okay, when I'm working on this, like the oils, the intention's already set for you. But if you're doing it with healing, you have to go, okay, I'm treating the state that the body is in, right?
Okay.
Just like you would target stress or trauma, here you're going for the state, right? And then you kind of let that go and you go, okay, now the essence of the body, because like, even if you look at the nervous system, there is the physical nervous system, which is a reflection of an inner nervous system that is more etheric, not physical. So there is a physical component, which you could call the state, and then there's the essence, right? The energetic kind of blueprint that everything's following. And so
Right.
you kind of go back and forth between, okay, I'm going to focus on the state that the body's in, and then the essence that's flowing through the body, be it the
Got it.
blockages or the quality of energy that's passing through the form. And as you do that, what comes out is fear. Like, you don't even have to target fear. Fear just comes out. Doesn't matter who you work with. Like, if you focus on essence while you're doing energy healing, what comes out is fear. And
I
so,
see.
yeah. And so you're going to go back and forth with the oils. When you do the nerve help, it treats the state of the body, and then when you go to like the aloes or the poplar or the friar's balsam, the alchemical cobalt, you're treating the quality of the essence that's passing through the structure. And if you look at it from the point of yin and yang, it's like you keep working each one to try to get it to like evolve out of the place that it's at. Like you're working the form, you're working essence, you're working the form, you're working the essence. And whenever you increase essence, it starts to change the form. When you change the form, it changes the essence that it attracts. So you almost just keep like evolving it out until you're just like out of that situation, if that makes sense. So it's like another way of saying you're changing the frequency of the radio station that's playing the thought processes in the head. Like you could keep wrestling with the
Got it.
thoughts and the behaviors and the opinions and all that, or you just change the station.
Mhm.
At some point when you're treating it and it's non-responsive, it's time to change the station.
Got
Does
it.
that make sense?
It totally. Yes.
Yeah.
Thank you so much.
You're so welcome.
Appreciate you always. Thank you,
Yeah,
Sam.
thank you. It was good seeing you guys up there.
You too. It seems like ages ago, but I was like 2
Yeah, I
weeks.
know, huh? It seems like it was a long time ago. It was like what, a week and 10 days, something like that.
Right?
Yeah.
Yeah, that was so special. Thank you so
Yeah, it
much.
was. Good. Thank you.
Mhm.
And then go ahead, Barbara, then Victoria.
Hey, Barbara.
Hey there.
Hey, hey.
Speaking of yin and yang,
Uh-huh.
I'll come back to that. 2 of the past 3 mornings I have had really significant head congestion.
Hey.
I've done all kinds of experimenting to see what would move it. And I've also been working with the oils from the Sandalphon technique.
Okay.
And one of the ones that seems to move the most energy is a yin yang pattern. I don't know
Okay.
if that.
Yeah. So you're waking up with mucus, but you're not necessarily having it throughout the day, or you are having it throughout the day?
Well, I think some of it is sinus, but I think some of it is just energy that's stuck in the head and doesn't move out.
Okay.
As I'm going through the vital center oils tonight, they feel like they're hitting me differently, and a couple of them have seemed to open up the sinuses a bit, and some of them have seemed to move energy up to the crown.
Okay.
But it took until about 1 o'clock this afternoon for the energy to clear my head.
How about, do you happen to have any anula?
I think I have a small bottles.
Yeah, let's have you inhale anula, and then how about rosemary or rosemary verbena?
Yep.
So I'd rotate between the two, and I'd even take a few drops of the rosemary or rosemary verbena internally. And then do you happen to have any like aloe vera in the house?
We do.
Why don't you take like put like a little bit of aloe vera in your hand, and then a couple of drops of the rosemary, and then try rubbing it like on your head and temples and on your jaw and on your face, and like just kind of work it around wherever it feels comfortable, and see how that treats you. Going back to increasing the circulation in that area, you're reducing inflammation, you're stimulating lymphatic movement in the face, which will help throw off lower vibrational energy, but help to also reduce any sort of lymphatic congestion in the sinuses and things like that. I would actually try doing that. And even if you want, you can rub a little bit into the temples, and I think that could feel quite nice.
Okay, I will try that. So
Yeah.
it sounds like you're thinking this is more sinus congestion than.
Well,
Or it's part,
if you stimulate lymphatic function, it will throw off the energy congestion. And so,
okay.
like this approach, it's like it doesn't matter if it's physical or energy. It
Okay.
should kick them either way. It should kick it off the head.
Great.
Yeah. So yeah. The thing that's nice about the Anula is it can be quite clearing. You know, it opens up the sinuses. It helps with the heart, but it also takes just like tension out of the it's an antispasmodic, so it takes tension out of skeletal muscle, smooth muscle. It just takes tension out. So the combination should work really well for that.
Thank you.
You know, like sometimes if the fascia is really wound up, even though you're doing stuff to like kick energy off, it's like the connective tissue doesn't allow too much to come off. So one is you're opening up the connective tissue. The other one is you're stimulating lymphatic movement so that it's just kicking stuff off.
Okay, thank you.
Yeah.
The other thing
And
that's
then if it doesn't work, let us know in a day or so.
okay. The other thing that's going on is some kind of nerve issue in my left hand since about Friday. The wrist in particular, but if I roll my hand inward with any kind of pressure on it or holding anything, I'm yelping like a dog and dropping whatever's in my hand.
When you go like this?
Yeah, roll it in with any kind of force or weight. Even
What
just
about when
brushing.
can you do this?
Uh-huh.
Okay, so it's the rolling.
Yeah.
Okay.
And
And there was no injury, there was no anything, it just started to happen.
yes, periodically I get it briefly and it resolves. But it's been fairly constant since Friday.
Do you happen to have helichrysum?
I do.
So probably like more like up here
Uh-huh.
than down low. Like put it on up here and do it on the backside, and then go through and like you're pinching down your arm.
Okay. I've done that, but not with an oil. I do
Yeah.
with helichrysum.
Yeah, do it with the helichrysum.
Okay.
I think you have a little bit of either a trigger point or a little bit of a fascial lesion, like in between the two bones. There's a trigger point that can happen that can cause that. And so just going through and doing that over a period of time, that should unwind that.
Okay. Thank you very much.
You're so welcome.
And then go ahead, Victoria, and we have some chats as well.
Hey, Victoria.
Hi, how are you? Yeah,
Hey, how are you?
I'm good. I'm great. Greg, this is really a treat and an honor to be able to meet with you here. I've come to your
You're so
work
sweet.
relatively, recently, but my question really has to do with sleep disruption. It's pretty severe. 2
Okay.
years ago, I had a premature Kundalini activation that went into a
Okay.
symptom. And I've spent the last 2 years coming back from it. And
Okay.
it's been slow and gradual. And basically, I've been treated the last year with nervous system and adrenal dysfunction.
So
and
tell me
things-
what happens. Tell me what happens. Like, so you're asleep, you've fallen asleep, and then you wake up, or you have a hard time falling asleep?
Can't sleep. I usually currently it's like I'm missing 2 days in a row of sleep. And sometimes, it skips through the week, but I maximum get maybe 4 hours, most of the time 2, and sometimes none. And it's been increasing, even though I've been treating it with a number of supplements, and I'm working with a naturopath. So there's a lot that's going on here, but I'm curious why it's in a kind of a severe place.
So was there ever any pain involved with any of this? Was there like an injury, or you threw your back out, or anything like that?
No,
Okay.
no.
So you were doing meditation, you had a Kundalini issue, and then the sleep become unregulated.
Well, I think there was a lot of trauma that happened for about a 3-month period while the electrical activations were going on, and it was severe. But I got it to stop.
Give me an idea of what was happening.
Electrical surging for anywhere between an hour and 5 hours a day for 3 months.
Surging like in your legs or through your whole body?
Whole body, whole body.
Okay. And do you have any pain now? Do you have any pain syndrome?
No.
Nothing going on.
No.
Do you get overstimulated by the environment, by light, by noise?
Yeah, all of it. And that wasn't
Yeah.
the case before.
So I would do a couple of things. One, I would use sage, like just like you could use regular sage, you could use Spanish sage. I would do it all over the body, like in a body tonic, which is like alcohol and witch hazel. And then just like slather it on like the whole body. You know, the body tonic will dry really quickly. But so a couple of things is like sometimes what happens is the nerves become very overstimulated, specifically the sensory nerves. And you know, that would make sense with the surging. And so the sage, for one, helps to fortify the body, and it helps to deal with any sort of brain fatigue that might be there because of all the neurological activity. And then it calms down the sensory nerves. And so it's one of the best things for something like this. And if there's some fatigue there because of the lack of sleep and all that, it's helpful for that. And then it helps to fortify and regulate the adrenals on top of all that. So you're kind of hitting all the big hits all at once. I would do that daily. I would even maybe inhale a little bit of sage right as you're going to bed. You might want to rotate between sage and tarragon, like 10 inhalations with one, 10 inhalations with the other, and then keep going back and forth. And the reason being the tarragon, you could use either tarragon or you could use marjoram. And you're looking at potential like disruption in the vagus nerve or the parasympathetic activity, so that like if the parasympathetic part of the nervous system loses tone, the part that's like fight, flight, or action oriented part of your nervous system just stays activated. And so, there's certain markers that you have to hit to be able to go to sleep. And when we don't hit some of those markers, your body just doesn't do it. Like, it just doesn't do it. And so what you're really kind of looking for is the ability to hit that parasympathetic state, which is rest and repair. And the marjoram or the tarragon will make it so that you have a greater potential for hitting it. It might take a few nights of inhaling it, but it should start easing you into that more parasympathetic state. And then that combined with the sage all over the body, it's a good chance that maybe the overstimulation of the sensory nerves is what is throwing off the parasympathetic activity. And so you're kind of hitting both things. If for some reason that still doesn't cut it, then we'd go to like blends that are good for really putting you into a deeper state of parasympathetic activity that you would use for like recovering from an injury or something like that. Here, you're not really recovering from an injury, but just recovering from being in that state like that. And you're just trying to reestablish the function of the nervous system. So the other good thing about the sage is, we can get into these like patterns in the body. And with the nervous system, as soon as the nervous system starts to go down a particular pathway, it doesn't judge it as good or bad. It just goes, this is what we do now. It becomes easier and easier. And it's called the writing reflex. And so when it fires down a different pathway, it just keeps doing it and just never stops. It never goes like, okay, we're going to do this for 48 hours and then we're going to go back. We had an experiment. We're going back to the way that it was. Like, it never does that. And so when we think of the idea of regeneration in the body, there's different kinds of regeneration, and one is to increase circulation to an area so that it gets blood and nutrients and things like that. But neurological regeneration isn't the growth of new nerve cells, it's actually re-education of how the nerve works. And one of the best oils for, again, regenerating the nerves, which means you're moving it back to like the more appropriate way of behaving. You're undoing that writing reflex, and you're helping the nervous system to go back to the way it was rather than where it's at now. Again, it's sage. Like, sage is one of the best things for breaking neurological patterns in the body. And so, I mean, you hit a lot of the markers with this. I would say treat it for like a week or two like this, but it's not going to be like a light switch where you go, you flicked it, you inhaled it, you put all the stuff on, and then you're like, oh, this is amazing. It's probably going to be a slow roll to getting better, but it should be shorter amounts of time being awake, going deeper and deeper into sleep, waking up, maybe less. Like, everything will just keep getting smaller and smaller until at some point it just goes away. And so I would start with those two things. Yeah.
Wonderful. When you say sage, are you talking about the essential oil or the actual leaf?
No, the essential oil. So
Okay. Yeah.
here you could use probably Spanish sage would be good, just because you can do big dosages, and there's different kinds of sage essential oil. But here I'd probably do Spanish sage.
Thank you so much.
You're so welcome.
Thank you.
Very excited about all these free classes. Could you talk about the upcoming ones? We have lymphatic technique 8 with the lower back and psoas. We also have the free study group coming up, and they just want you to talk about, because I don't have anything on the website.
So lymphatic 8, we did the lymphatic 7, which was the neck. So this will be focusing on the hip flexors, which are known as the psoas, and so it's a low back issue. And we basically are just going through and looking at it, not so much from a point of view of a symptom-oriented approach. We do treat symptoms, but we also look at what are the contributing factors to the psoas being wound up. And so when the psoas is wound up, it can throw off your breathing, it can throw off digestive function, it can throw off lymphatic function, it can cause urinary and bladder issues, can throw off women's cycle. And for men, it can cause pain down into the testicles and throw off part of their function in that area. And then it could be also very painful, like radiating down the leg and then going up and down the spine. Like sometimes if you have back pain, you kind of rub like side to side. That is usually more of the abdominal muscles. When you rub up and down your spine, that is the hip flexor or the psoas. And so there's 3 key muscles that you kind of look at when you're doing osteopathic evaluations, or at least I did back in the day. One is the neck, one is the diaphragm, and one is the hip flexor. And forms of anxiety can come from it. When the hip flexor attaches to the last 5 vertebrae of the spine. So anytime that the body feels unstable, these muscles tighten up, and they'll cause, just a super wide range of problems. In osteopathic practices, they refer to the psoas as the hidden prankster, because it just causes all this weird dysfunction in the gut, in the urinary tract, the women's menstrual cycles, like all those things I was saying, plus different pain syndromes. And then it becomes harder and harder to treat. It starts to throw off the way we walk, the gait, can throw the breath off, can throw like anxiety is not exactly the right word, but there's just this weird tension that can be in the body that, like, it's an overstimulation of instinctive responses that gets generated when the psoas is tight. And I would say everybody has a psoas issue, like everybody. Nobody gets away from it. And so we're going to go through, it's just a 1-day free class, but we're going to go through and look at how to go through and unwind it. And we use like Palo Santo, there's different things that we use for this, but our person that works in the office, her partner is not into any of the oils or anything, but he started having some aches and pains, and they were describing it to me, and I kept saying, oh, it's like a psoas issue. And finally they were going to do something about it. So we just did one step out of what we do in the class with like the Palo Santo, and he's like, I don't know anything about these oils, but like it's amazing. Like I just sit and inhale these oils and my back's better. I can get up and do stuff. And he's had like a super chronic back issue for a long period of time, and he's not even putting the oils on, he's just inhaling it. But have him doing a simple little pattern for it, and he just says, like, if his back starts to flare up, he sits and does it, unwinds it, and moves on. Now, if he'd do the whole thing, he probably wouldn't even need to do the tune-ups very much, but that pattern's been there for a while. And so all of this, anytime the neck, the diaphragm, or the psoas is off, it completely throws off your lymphatic function. And so this will help to deepen the level of lymphatic function, especially closer to the bone. And it should help with hitting the anabolic state, which is a state of recovery that happens while you sleep. So we'll be kind of addressing all of that in the class. And the kit is real simple. We'll list it on Wednesday of the oils that you need for that. But it's pretty straightforward. You probably have most of it in your repertoire. It's like Palo Santo and frankincense, and it's stuff that you use. So it shouldn't be any big thing that you need. And then what's the other one?
And the other one is the study group.
Oh, the study group. So that is, from time to time we do a thing where we just open it up for the day and anything goes, kind of like this little session, but a longer version of it. But I'm also going to be peppering throughout the day therapeutic strategies on how to address various conditions. I might just let it pop up in the day itself, what we're going to cover, but I'm going to go through and just have like a combination of approaches that you can go to treat, like the immune system, or like sore throat, kind of like what we did in Clinical Corner this last week, where there's 3 or 4 steps of just going through and fortifying the immune system going into cold and flu season. And so, it will be therapeutic strategies like that, just drawing on the things that you have in your kits and your class kits and things like that in a way that can produce a result for different potential health issues and things like that. So,
and for anyone who hasn't seen, we have a lot of free classes coming up for the rest of the month, and so we'll keep getting more information up for you for those. But yeah, the free study group ones, I just want to do a little thing and say they're great for new people, because even a lot of times if people don't have oils, they can even just like jump in and learn a lot. So and Robert's posting some of the other ones. We have the Uncle Bob coming up, the esoteric meaning of green and red for Christmas. Yeah, I don't know if you want to talk about either of those now.
Yeah, a little bit. Yeah.
And good questions tonight, guys. I think
So we
can
need
do
a process?
yeah.
Okay.
Oh, go ahead, Robert.
Hey, Robert, how are you?
Hey, Greg, doing well, thank you. I have a strange question. About 30 years ago, when I moved to San Diego, I went through a period of time with chronic recurring sinus infections.
Okay.
They would treat them with antibiotics. I go in, they check, I'm fine.
That's when you moved to San Diego or before you moved to San Diego?
Shortly after we moved to San Diego.
Okay.
And my doctor was saying, well, the way to fix this is to do surgery. And I was a little panicked about it. And I talked to an uncle who had gone through the surgery and said it was horribly painful and it didn't help a lot. And so my doctor suggested as an alternative doing nasal lavage, which I have been doing pretty much consistently for the 30 years. And there were 2 times where I stopped for some reason for a few days and I got a sinus infection. Now that was 15 years ago or so. And I think my body's changed a bit since then. Part of me would like to stop the nasal lavage. Yeah. But then I don't want to say there's a fear, but there's this what's going to happen?
Yeah, I get you. So is there any issues with the jaw? Like, do you have like tight jaw? Do you clench at night? Anything like that?
I grind at night. I have a mouthpiece I wear.
I would say it's probably more the grinding than it is the sinuses. And so I would start doing see, with grinding. I mean, I would probably do like marjoram. You could do petitgrain or basil. Like I would go kind of heavy. I would go like 3 or 4 drops in a little thing of water and then put it in the mouth and just like, really swish it around, and then even put a couple drops and go like back to where the jaw hinges, and then just rub a little bit of the oil on each side of that. And rosemary would also work, actually, now that I think about that.
Any specific kind of rosemary?
Either one. Rosemary verbena. I mean, actually, as I'm thinking that out, I kind of like the rosemary a little bit better, just because it also would potentially reduce the stress in the sinus cavity and increase some of the blood supply to the mucous membrane there better than the other ones. And so maybe try the rosemary as the mouthwash. And I would do that daily before you think about like stopping the flushing on your nose every day. Like do it for a few weeks and then start to see, like, do you notice a change or anything like that? But between the sternocleidomastoid and some of the deeper muscles in the jaw, it's most likely the lateral pterygoid, which is just this, like, if you stick your finger in your mouth and you go back to where the jaw hinges and you kind of rub that big muscle back there, it almost feels like it burns a little bit. It's because it's so flippin' tight. Like on everybody, it's just so flippin' tight. And so if you can unwind that, it will change the sinuses.
Okay, so just I was copying and pasting, so I want to review if I could. You said marjoram or petitgrain or basil in some water and just swish it in the mouth, or did you want me to do rosemary?
You could try all those, but I would probably go rosemary. Okay. Like, as I sit with it, I kind of, the more I sit with it, the more I like rosemary for that.
Okay. And then rubbing on the lateral pterygoid would be
I'd still do rosemary.
Oh, still rosemary. Okay.
Yeah.
Okay. And you said several weeks.
I mean, you'll start to probably, if it's going to work, you'll probably start to notice something within a few days. But like, I'd give it a few weeks before you stop, like going, okay, I'm not going to do my routine tonight. Like give it a little bit.
Yeah. 30 years is a long time to give up something, but I also know it's time to give it up.
Yeah.
I can feel that the salt has an impact on the body.
Where did you move from?
Orange County.
Okay, so not that far away.
No, not that far. And it wasn't allergies. It was just something different.
Yeah. Yeah, my guess is it's the pterygoids and the sternocleidomastoid, and sometimes there's other muscles on the jaw, and that plays a bigger role in sinuses than we give it credit for.
Yeah.
Yeah.
So I'll work the SCM and do the rosemary and get back to you in a month.
Yeah, perfect. Or even 2 weeks.
Okay. Thanks.
You're so welcome.
I'm just finding it very interesting for myself. And yeah, good questions.
Okay, so let's find them. We're just gonna do. Let's pull out if you have helichrysum, you have wintergreen, poplar balsam, APR, fascial release. Let's see if they have one of those, and if not, we'll come up with some other choices. But seems okay. Okay, so we're gonna just treat some body tension stuff, and going into a little bit of what we were talking about with Chris about hitting some of the centers associated with the will, but here it's more for like pain syndromes or like areas in the body that are compromised. So close your eyes, and before you start inhaling, just check in with your body. Check in with the area or areas where your body feels a little bit compromised. It could be a pain, a muscular issue, arthritis, or it could be other things. Like Robert's got a jaw thing and sinuses, so he could check in with his jaws and sinuses. So like if we use Robert as an example, like, we just talked about like, okay, these things can be done to go through and treat some of the structural issues that are there. But here we're gonna use whatever oil that you're using here to unwind some of that area so that it responds quicker to treatment. So whatever oil, APR, King of Pain, Helichrysum, Poplar, Wintergreen, inhale with your awareness on the compromised area. And for Robert, it would be like inhaling on the jaws themselves, like wherever he feels tension in the jaws. So if you have an issue in your shoulder, then your awareness is on your shoulder. If it's on your hip, then do your hip. Long, slow, deep breaths. Nice, long, slow, deep breaths. And then just pause and be still for a moment. And then same spot, same area, start taking nice, long, slow, deep breaths. Your awareness is on the compromised area. So again, if we use Robert as the example, even though he's talking about sinus issues, we're talking about unwinding the jaw. So you would put your awareness on that affected area. For him, it would be the jaw. And you're doing long, slow, deep breaths. That way, when you go through and do the treatment that we talked about, it has the potential for being more effective because we've unwound it, right? Nice, long, slow, deep breaths. And then just let it go. Notice how your body feels. Begin inhaling. Your awareness is on the bottom of the tailbone, the basic chakra. Your awareness is on the front, solar. Is the area below your ribs on your upper abdomen. Long, slow, deep breaths. And then the back solar. Nice, long, slow, deep breath. And in the area between your eyebrows. Your awareness is between the eyebrows on the ajna. And then the crown, the top of the head. And then just be still. Just be still. Let's go back to the affected area. Wherever that is, nice, long, slow, deep breaths. Yeah. And then your basic, the bottom of your tailbone. And then the bottom of the tailbone, the basic chakra. Awareness is on the bottom of the tailbone. The front solar plexus. The area below your ribs. Your back solar. Nice, long, slow, deep breaths with your awareness on the mid back. The area between your eyebrows. And the top of your head. And then just be still. Just be still. Okay, we're going to use the same oil, but now you're inhaling, your awareness is on your lungs. Nice, long, slow, deep breaths with your awareness on the lungs. Drop down to your liver, right hand side below the ribs. And then from your midline, 2 inches over to the right, below your ribs, that gallbladder area. And then the kidneys. Your awareness is on the kidneys. And then the spleen on the left-hand side below your ribs. And then just be still. Notice how you feel, your body, your emotions, your mind. Now, body tension can be more than just like, oh, I have tight muscles. There could be tension in the body associated with postural misalignments, things going on with the nervous system. Sometimes the body just gets wound up in a pain cycle where it's hard to break out of it. There could be all kinds of reasons why to utilize this. Basically, think of it like this. The first part, you're working the aspects of the will, right? You're working the physical will, the emotional will, the mental will, and the spiritual will. And so it makes it easier to move towards healing. Sometimes the will gets so locked into place that it's hard to have any sort of movement internally towards healing. And so body tension could also just be the tension associated with moving real slowly towards healing. And so if you have a condition where the body's not responding very well, it's not responding at all, it's making a little progress and then it snaps back, there's lots of things to look at. Am I doing the right protocol? Am I using the right things? Am I addressing the right issue in the body? But sometimes what the issue is, it's an issue associated with this will aspect, right? So here we're just referring to it as body tension, but you could call it body tension / will aspects for healing. And so let's share experiences and just talk this out a little bit. And if we have time, we'll do a little bit more, but let's just see how everybody processed it and share an experience or ask a question.
Yeah, go ahead, Robert.
Hey, Robert.
Hey, Greg. So I guess I've never really noticed directly, but my teeth always want to be firmly closed.
Yeah.
And in doing this, it's like, oh, there's a gap. They don't need to be closed.
Right. That's usually associated with a little bit of bruxing at night. It's not like you're really like clenching them, but they're like, there's like a tension where it's like it's keeping them like in that closed state. And if you paid attention to your jaw, there's like a little bit of like clamping down in the jaw. And so by going through and doing this, you're unwinding it. And, this isn't necessarily something where we said like, do this to unwind it, but the thing that we talked about you doing, this would make it work better. Like this would make it work easier. It's not specifically addressing the issue that we talked about, but it's it's supportive or augments the thing that you'll be doing in with the jaw and everything.
So this might be a good thing to do for a few days before starting the rosemary, or
you could do them simultaneously. Yeah.
okay.
Yeah.
Good.
Honestly, this like little protocol right here, like I don't even do the second part very much. I do that first part all the time. You know, like if I'm sitting, you know, because I usually have one of these oils in my pocket. Um, if I'm sitting for any length of time, I'll pull it out and I'll just, you know, do like a little 2-minute version of, okay, affected area, basic, front solar, back solar, ajna, crown. And then, you know, I'm just constantly like dressing it. And it just makes it easier to treat the other things that you need to treat when the time comes.
Excellent. Thank you.
Yeah.
Someone shared the mental watchman has gone on a tea break.
Yeah. Boy, yeah. It's probably having a tea break with my mental watchman. Yeah. Yeah, it's an interesting thing, you know, because a lot of sometimes even I don't know. There's just a tension there that you don't really realize until it's gone. And then once you've kind of dissipated it, you recognize it when it's back. You know, like you called it the mental watchman. I would agree. It's just something where, you know, you're on guard, you're waiting for the other shoe to drop, or, you know, about another one on my tab, whatever it is. Yeah.
Body feels like a softer lump.
Yeah. Yeah. I mean, it could even be a way to unwind at night before you go to bed.
I feel just like I did my jaws as well.
Right.
And my neck feels looser.
Yeah.
My sinuses are draining better.
Yeah. So Samantha's saying she did her jaws and her neck feels better and her sinuses feel better. You know, we don't really think of the jaws as being an issue for the sinuses. It's actually a big issue for the sinuses. The sternocleidomastoid and the jaws heavily impact the sinus issues. So just treating sinuses can be effective, but if you start working in some sort of routine for unwinding the jaw, you'll notice that anything sinus, neck, shoulder related gets better much faster, much faster. You know, even if the jaws are tight, it activates the solar plexus, it activates the Ming Men, and it makes the forehead a little bit overactivated. So it makes you a little bit more sensitive, and it makes it easier for the body to get agitated, which eventually impacts the emotions and the mind. So, I mean, it's just a way to just unwind all of that stuff. Yeah.
That was all the shares so far. I say we keep going.
Yeah, let's do another round. So we only did one cycle of the organs of blood purification. Let's do another one there. And then we'll add a little spicy piece. So begin inhaling. Your awareness is on the lungs. The liver, right hand side below the ribs. And then your gallbladder, which is the right hand side. Excuse me, go to your midline, 2 inches to the right, below your ribs. The gallbladder. And then the kidneys. And the spleen, left hand side below your ribs. And then just be still. Now your awareness is going to be on your spine from the upper back and mid back. Don't pay attention to the neck. Don't pay attention to the low back, just your upper and mid back. Your awareness is there. Your awareness is on the upper and mid back. And then just be still. How's that feeling to you? Yeah, more energy. Do it one more time. Upper and mid back. And then just be still. So again, Let's share or ask questions. Go ahead and fire away. Everybody's pretty chill. Well, like I said, you can use this to augment any other condition that you're trying to treat, especially if, it's not responding to normal treatment. Sometimes it's just this aspect that if you unwind it, it starts to allow for a healing process to engage. So.
Seems it was a sleepy time tea.
Yeah. Okay, you guys. Well, we're going to slip over to the STAR session here in a couple of minutes. So remember the study group tomorrow night for the transformational astrology classes is Wednesday. And then this weekend is the medulla and vagus nerve class. So, yeah, fancy.